Thank you. I want to pick up on this last comment actually that Michael made around the promise of medical diagnoses in using machine learning and digital tools. So I study many entrepreneurs who attempt to do this, and then the organizations that attempt to use these technologies in practice. So picking up on kind of this ecosystem theme that was placed in this question. And by the way, these questions were fantastic. They're great research questions for those of you who posed them. I don't think we have the answers yet on any of them. So good luck with your further research. But I picked this up around this point around medical diagnostics, because I think there's an inherent question of what do you want the technology to do? Do you want to focus the technology on doing the things that, interestingly, Samir said was augmenting, I would argue is substituting. In other words, curing things that doctors actually know how to cure. Or do you want the technology to focus on curing things that are extremely novel or things that we would never as humans be able to see? So, I work with an entrepreneur that their technology takes pictures of your skin, and they can do both. They can identify skin lesions that doctors can identify, and they can identify these crazy anomalies that you and I can't see, but that the machine can detect and know that you are likely to be ill. So which one do you focus on if you are the entrepreneur in the system? And then if you're the organization, what type of technology do you adopt? For what purposes? And in doing so, what are the ramifications of that? So in the example that Samir shared with us about this augmenting process, reflecting on what Stella had to say, right? I could see a world in which the doctor would be very unhappy with receiving that technology and push back as a result, right? Would they be more happy if they received a piece of technology that allowed them to identify things that they could never dream of? Or would they find that more threatening? And these have great implications for both the, if we say, unfortunately, thinking about professions, but also thinking about organizations and the structure and power that lives within organizations, and what that does to how people view their roles in an organization and their work more broadly. And then if we kind of get at a higher level, well, what's the goal of kind of the ecosystem more broadly? Should we be focused on ways to kind of create a more efficient existence, or should we be focused on ways to create a more high quality existence in healthcare? And these have sincere implications for the design, use, and adoption of these technologies. And how do we incent people to do one or the other? I mean, you can live in either world, right? And make a case for either, but that suggests something unique and distinct about the strategy of this ecosystem and the types of technology that should be deployed as a result.